I am Dr. Hina Kim, men's health and wellness specialist. If your energy feels different after 50, it often reflects small shifts in sleep, movement, and daily habits working together. Have you noticed which part of your routine changes your energy the most during the day? I am Dr. Hina Kim, men's health and wellness specialist. Today I want to explain something very common in men aged 50 to 60. Feeling tired more often is not unusual at this stage of life. It does not always mean something is wrong, but it does mean your body is changing. As we age, natural hormone levels slowly shift. Muscle mass can gradually decrease. Metabolism may become a bit slower than before. Sleep patterns can also become lighter or less consistent. These changes together can affect daily energy levels. Another important factor is lifestyle balance. Many men in this age group have long work histories and ongoing responsibilities. Stress that stays in the body for long periods can influence energy and recovery. Nutrition also plays a key role. Meals that are low in protein or missing important nutrients may not fully support energy needs. Hydration is often overlooked as well. Even mild dehydration can make you feel more tired during the day. Physical activity is another key point. A very inactive routine can reduce stamina over time. On the other hand, sudden overexertion without conditioning can also lead to fatigue. The goal is balance, not extremes. Regular movement, even light walking, supports circulation and energy regulation. Sleep quality is equally important. Not just hours of sleep, but how restful that sleep is. Screen time late at night or irregular sleep schedules can reduce sleep quality. Medical factors can also contribute in some cases. Blood pressure changes, blood sugar levels, or thyroid function may influence energy. This is why routine checkups are important after age 50. I always encourage men to pay attention to patterns, not just single days of fatigue. If tiredness becomes persistent or starts affecting daily function, it is worth discussing with a healthcare professional. Simple lifestyle adjustments can often support better energy over time. But every individual responds differently, so personal evaluation is important. There is no single explanation for fatigue, and there is no single approach that fits everyone. Understanding your body's signals is the first step toward better long-term wellness. And in the next part, I will explain how small daily habits can support more stable energy levels after 50. One of the most effective areas to focus on is daily routine consistency. Your body responds well to regular patterns. Waking up and sleeping at similar times each day can help stabilize energy rhythms. Even small adjustments in timing can make a noticeable difference over time. Another key factor is breakfast quality. A balanced morning meal that includes protein, fiber, and healthy fats can support steadier energy levels throughout the day. Skipping meals or relying on highly processed foods may lead to energy fluctuations. It is also important to consider muscle health. After 50, maintaining muscle becomes essential for overall stamina. Light resistance exercises, even with minimal equipment, can help support strength and physical endurance. This does not require intense training. Consistency is more important than intensity. Breathing and stress management also play a role in energy regulation. Chronic mental stress can increase fatigue even when the body is physically rested. Simple practices such as slow breathing or short breaks during the day can support better balance in the nervous system. Hydration should remain steady throughout the day. Instead of drinking large amounts at once, regular small intake is generally more effective for maintaining energy balance. Another often overlooked factor is vitamin and mineral status. Nutrients such as vitamin D, B vitamins, and iron are involved in energy production processes in the body. A healthcare provider may recommend checking these if fatigue is persistent. It is also important to monitor caffeine use. Moderate intake can support alertness, but excessive use may disrupt sleep and long-term energy stability. I also advise paying attention to how your body responds after meals. Heavy or high-sugar meals can sometimes lead to temporary drops in energy. Balanced portions tend to support more stable daytime performance. At this stage, the goal is not rapid change, but steady improvement in daily function and comfort. Small consistent habits often work better than sudden major adjustments. And as we continue, it becomes important to understand how sleep quality, hormone balance, and daily activity interact together in shaping long-term energy patterns. Another important component is sleep quality consistency. As men age, the depth of sleep can naturally become lighter. This makes sleep hygiene more important than before. Reducing bright screen exposure in the late evening can support melatonin regulation. Keeping the sleep environment quiet, dark, and cool may also help the body enter deeper rest phases. Hormonal balance is another area that can influence energy levels. Testosterone levels, for example, may gradually decline with age in a natural way. This does not always require intervention, but it can be considered in a broader health evaluation when fatigue is persistent. Thyroid function is also relevant because it directly affects metabolism and energy regulation. When these systems are balanced, daily energy tends to feel more stable. Cardiovascular health is another key factor. Efficient blood circulation supports oxygen delivery to muscles and organs. Even mild reductions in circulation efficiency can contribute to feelings of tiredness. Regular physical activity, even at a moderate level, supports heart and vessel health over time. Another area to consider is metabolic health. Blood sugar fluctuations can influence energy consistency throughout the day. Eating balanced meals at regular intervals may help maintain steadier levels. Long periods without food, followed by heavy meals, can sometimes create noticeable energy swings. Mental focus and cognitive load also contribute to perceived fatigue. Extended periods of concentration without breaks can increase mental exhaustion. Short pauses during work or daily tasks can help maintain clearer mental energy. Social engagement and mental stimulation are also part of overall wellness. Low activity in daily routine, both physically and mentally, can contribute to reduced vitality over time. Gentle daily structure, including light activity and regular rest periods, supports better balance. It is also important to recognize medication effects in some individuals. Certain commonly used medications may have fatigue as a side effect, depending on dosage and individual response. Reviewing this with a healthcare provider can be helpful when needed. At this stage of life, the focus is on understanding how multiple systems work together. Energy is not controlled by one single factor. It reflects sleep, nutrition, movement, stress balance, and internal health systems interacting continuously. And as we continue, it becomes important to look more closely at how long-term lifestyle patterns can gradually shape overall energy stability and daily functioning. Long-term lifestyle patterns play a central role in how energy is maintained over time. Even gradual daily habits can accumulate and influence overall vitality. One important area is chronic low-grade inflammation. This is not always noticeable in daily life, but it can affect how the body feels in terms of fatigue and recovery. Diet patterns rich in whole foods, vegetables, and adequate protein may support a healthier internal balance. Gut health is another factor increasingly recognized in general wellness. Digestion and nutrient absorption influence how efficiently the body produces energy. A consistent, fiber-rich diet can support more stable digestive function. Physical posture and musculoskeletal health also contribute to perceived energy levels. Poor posture over long periods can increase muscular strain and reduce efficiency in movement. Gentle stretching and mobility work can support better physical alignment and comfort during daily activities. Circadian rhythm alignment is another key element. Natural light exposure in the morning helps regulate internal biological timing systems. This can influence alertness during the day and rest quality at night. Spending some time outdoors during daylight hours may support this natural regulation. Preventive health monitoring remains an important foundation at this age. Regular screening for cardiovascular markers, glucose levels, and metabolic indicators helps identify changes early. This allows for more informed lifestyle adjustments when needed. It is also useful to understand recovery capacity. After physical or mental effort, the body may require slightly more time to return to baseline compared to earlier years. Planning adequate recovery periods between demanding activities can support more consistent energy. Environmental factors can also influence daily energy. Air quality, noise levels, and work environment conditions may subtly affect fatigue perception over time. Optimizing these factors where possible can contribute to improved daily comfort. At this stage, the goal is to view energy as a system-wide reflection of overall health patterns. Not one isolated factor determines how you feel each day. Multiple small influences work together continuously. And in the next part, we can further examine how personalized adjustments based on individual health profiles can help refine daily energy support strategies. Personalized assessment is an important step in understanding fatigue at an individual level. Each person has a different baseline for cardiovascular fitness, muscle strength, and metabolic health. Because of this, general advice can only go so far without individual context. A structured health evaluation may include basic laboratory testing and physical examination. These can help identify whether fatigue is primarily lifestyle-related or influenced by underlying medical factors. Functional capacity is another useful concept. This refers to how well the body performs daily physical tasks such as walking, lifting, or climbing stairs. Tracking small changes in functional capacity over time can provide meaningful insight into overall health trends. Gradual strength maintenance is also an important focus. Muscle efficiency naturally decreases with age, but this process can be slowed through consistent resistance-based movement. The goal is not performance training, but maintaining functional independence and stability. Cardiorespiratory fitness should also be considered. Moderate aerobic activity supports oxygen utilization and energy production efficiency at the cellular level. Even low-impact routines can contribute positively when performed regularly. Nutritional adequacy becomes more specific in personalized planning. Instead of general recommendations, focus shifts toward whether daily intake is meeting individual protein, fiber, and micronutrient needs. In some cases, dietary adjustments are more effective than adding supplements without evaluation. Supplement use, when considered, should be based on identified deficiencies or clinical guidance. Unnecessary supplementation does not always improve energy and should be approached cautiously. Another key aspect is consistency in health monitoring. Periodic reassessment allows adjustments to be made based on changes in health status over time. This helps avoid both undermanagement and overcorrection. Stress load evaluation is also part of personalization. This includes both psychological stress and physical workload distribution across the week. Balancing effort and recovery cycles is important for sustained energy management. When fatigue is evaluated in a structured way, patterns often become clearer. These patterns help guide practical, safe adjustments rather than broad assumptions. At this stage, understanding your own baseline becomes the foundation for all further lifestyle decisions. And from here, the focus naturally shifts toward integrating these insights into a simple, sustainable daily framework that supports long-term stability in energy and overall wellness. In summary, persistent tiredness after 50 is usually the result of multiple small factors working together. These may include changes in sleep quality, physical activity levels, nutrition balance, and normal aging processes. In some cases, medical conditions or medications can also contribute, which is why evaluation is important when symptoms continue. From a general health perspective, the most supportive approach is consistency. Regular sleep routines, balanced meals, and steady physical movement all work together to support energy stability. Paying attention to hydration, stress levels, and recovery time can also make daily functioning more manageable. It is also important to avoid expecting rapid changes. Energy patterns typically improve through gradual and sustained lifestyle adjustments. Small improvements, maintained over time, often have the most meaningful impact. If fatigue becomes persistent or affects quality of life, a healthcare consultation can help clarify underlying factors. I am Dr. Hina Kim, men's health and wellness specialist. I encourage focusing on steady habits, routine health monitoring, and balanced lifestyle choices as part of long-term wellness support.